do you have any experience at the retreat helping people with MS?
Yes, in my latest book, I'm sure people have read, know about my latest book, Eat for Life. I think I have at the beginning of each chapter and the end of each chapter another case history. I framed each chapter with a case, a success story on both sides of each chapter, and I probably have about 5 or 6 cases of MS recovery right in that book, right, just with examples. But yes, MS is an example of an autoimmune disease, and these autoimmune diseases, like psoriasis, like lupus, like multiple sclerosis or MS, like rheumatoid arthritis, right? These diseases respond favorably, but the time frame for recovery is different from person to person. And you're able to, so sometimes, so the trick is that I have obviously 30 years or 35 years of experience taking care of people with autoimmune conditions like that, and knowing when the nutrient levels in their tissues have been normalized, so it's time, so the medications can be withdrawn slowly to not exacerbate a re-exacerbation of their underlying condition. So yes, we have people with relapsing and remitting MS make great recoveries, but there are some people with progressive MS that have progressed to the point where they've had so much nerve damage in there so much central nervous system damage where they can't expect a complete recovery. But for most types of MS, especially the relapsing and remitting type, especially when we're catching it relatively early, we get phenomenal results.
Wonderful. And there's a question from Karen. Can you help people with early Parkinson's?
We have a person yes, we can help people with early Parkinson's. We had a person who just left, who was here, who got great response, is doing so much better with her Parkinson's, and and cut her medications down when she was here. And yes, we can help people with early Parkinson's. That's correct.
Great. And Greg would like to know, what about non-Hodgkin's lymphoma? Can that be treated naturally if you have a tumor?
This woman, her name was Irene, but in any case, yes, I've had numerous patients who've had non-Hodgkin lymphoma that refused chemotherapy and just did the nutritional program, and their tumors shrink and disappeared, and subsequent CT scans and testing showed no further signs of lymphoma. They made total and complete recoveries without chemotherapy. Yes, that has been part of my experience.
Great. Thank you. And Deborah says, I was wondering if a person who cannot eat any grains, could they come and have a specialized diet?
We might serve some grain with breakfast, but that's optional. They can have a lot of other options besides eating the grain with breakfast. We usually don't have that much grains the rest of the day. There's no grains with lunch, and there's usually not grains with dinner either, but sometimes there could be a little quinoa, a little smaller, like a corn, something, there could be some kind of grain, but yeah, they could take that out and we'll substitute something else. No big deal.
And do you offer colonics there?
Absolutely not. Rare that a person would need a colonic. I mean, that's very rare. Sometimes certain medications can cause, but if that's the case, we could, there are places where they could go to get a colonic if that was a case where they absolutely had to have something like that. But no, would not offer that here.
Right. And Inessa says, how do you help perimenopausal women?
It's amazing how when you live a super health, when you do everything right, your body fat's the right percent, your hormones are balanced. By balanced, I mean lower. I mean, when your IGF-1 is low, your estrogen is low, your insulin's low, particularly insulin. People don't understand how high insulin can worsen both menopausal pain, inflammation in the pelvic region, and peri and postmenopausal issues when you're, so yes, it's not going to be the magic that happens the first week or two that you're here. But as your body fat gets into the more favored range, these problems and your nutrients get high and your toxicity gets low, which could take some months, then people get tremendously less feeling of estrogen deprivation. They sleep better and they have less discomfort.